Welcome to CUREYA. Today's topic is based on women who have revolutionized the Indian healthcare. Our Indian healthcare consists of many very famous people who had a part in revolutionizing, or one might say, changing and developing it to a whole other level. Today, we are here to talk about some of the very famous Indian women who had the major part in taking our healthcare towards a brighter future, even which we might have forgotten about. They are Kadambini Ganguly, Rukhmabai, Anandibai Gopalrao, Rajkumari Bibiji Amrit Kaur, Oluwalya. First is Kadambini Ganguly. Kadambini Ganguly was born on 18 July in 1861. She was among one of the first Indian female doctors who practiced with a degree in modern medicine in India. Ganguly was the first woman to gain admission to Calcutta Medical College in 1884. Subsequently trained in Scotland and established a successful medical practice in India. Her life was not easy as it seemed. Despite coming from an upper caste Bengali community that did not support women's education, Kadambini initially received English education at the Brahmo Eden Female School. Subsequently at Hindu Mahila Vidyalaya, Baligunj, Calcutta. She was also the first woman to pass the University of Calcutta entrance examination and also passed the FA Fine Arts exam in 1880. Kadambini was the first one to stand against the government at that time, with her husband Dwarkanath Ganguly, alongside to make sure that even women can study in Calcutta Medical College. She also was a gynecologist and in 1888 was appointed to Lady Dufferin Women's Hospital on a salary of Rs 300 per month, a princely sum in those days. Ganguly was heavily criticized by conservative society of her time. After returning to India from Edinburgh and campaigning for women's rights, she was indirectly called a hoe in the Bengali magazine Bangobashi. Her husband Dwarkanath Ganguly took the case to court and won, with a jail sentence of 6 months meted out to the editor Mahesh Paul. Ganguly died on October 3rd in the year of 1923. Second is Rukhmabai. Rukhmabai was born on 22nd November in 1864, an Indian physician and feminist. She is best known for being one of the first practicing women doctors in colonial India, as well as being involved in a landmark legal case involving her marriage as a child bride between 1884 and 1888. The case raised significant public debate across several topics, which most prominently included law versus tradition, social reform versus conservatism, and feminism in both British ruled India and England. This ultimately contributed to the Age of Consent Act in 1891. Rukhmabai got married at the age of 11 with her stepfather's cousin brother, 19-year-old Dadaji Bikaji. Despite having family troubles, Rukhmabai continued her education at her home with the help of books from a free church mission library. She couldn't go back to her husband because she knew that he would make her stop studying rather than supporting her. A case was fought between these two, which also made the headlines: Bikaji versus Rukhmabai, 1885. Restitution of conjugal rights, case by Bikaji. In March 1884, Bikaji sent a legal notice to Sakharam Arjun via his lawyers Chalk and Walker, asking him to desist preventing Rukhmabai from joining him. After the case was closed, she went to England in 1889 at the London School of Medicine for Women. Dr. Edith Peachy supported her education and helped Rukhmabai to raise funds for her education. She got support from Eva McLaren, Walter McLaren, and Countess of Dufferin's Fund for supplying medical aid to women of India. Rukhmabai returned to India in 1894 and joined a hospital in Surat. For 35 years, she served as Chief Medical Officer, then retired in 1929-1930. Rukhmabai passed away at the age of 91 and on 25th September in the year of 955. Third is Anandibai Gopalrao, or if we recall her by her original name Yamuna. Anandi Joshi was born on 31st March 1865. She was among one of the first Indian female doctors of Western medicine alongside Kadambini Ganguly, also one of the women from erstwhile Bombay Presidency of India to study and graduate with a 2-year degree in Western medicine in the United States. What inspired Joshi to become a physician was tragic, but she was determined to become one of the great. When her 10-day newborn boy had to give up on life due to lack of medical care, This tragic turn of event made her realize how much she can contribute by becoming a doctor in Western science. With the support of her husband, Gopal Raojoshi, Anandi Bhaiyoshi started her medical career at the age of 19. She completed her graduation from Women's Medical College of Pennsylvania in March 1886, and MD in obstetrics. She even wrote a thesis on obstetrics among the Aryan Hindus. The thesis utilized references from both Ayurvedic texts and American medical textbooks. Even on her graduation, Queen Victoria sent her a congratulatory message as well. On 26 February 1887, Anandibai died of tuberculosis before turning 22 in Pune. Fourth is Rajkumari Bibiji Amrit Kaur Oluwalya. She was born on 2nd of February in the year of 1887. She was an Indian activist and politician. Following her long-lasting association with the Indian independence movement, she was appointed the first Health Minister of India in 1947 and remained in office until 1957. Kaur also held the charge of Sports Minister and Urban Development Minister and was instrumental in setting up the National Institute of Sports, Patiala. During her years, she ushered in several healthcare reforms in India and is widely remembered for her contributions to sector and her advocacy of women's rights. Amrit Kaur had her early education in Sherborne School for Girls in Dorset, England, and her college education at Oxford University. After completing her education in England, she returned to India in 1980. Fourth is Rajkumari Bibiji Amrit Kaur Ahluwalia. She was born on her participation after returning from England. Amrit Kaur co-founded the All India Women's Conference in 1927. She was imprisoned by the British authorities for her participation in the Dandi March led by Mahatma Gandhi in 1930. The British authorities appointed her as a member of Advisory Board of Education, but she resigned from the position following her involvement with the Quit India movement in 1942. Kaur worked to reduce illiteracy and eradicate the custom of child marriages and the Parda system for women. Amrit Kaur and Health Department. She was assigned the Ministry of Health. In 1950, she was elected the President of World Health Assembly. As Health Minister, Kaur led a major campaign to fight the spread of malaria in India and also led the campaign to eradicate tuberculosis and was the driving force behind the largest BCG vaccination program in the world. She played a vital role in the establishment of the All India Institute of Medical Sciences, AIIMS, in New Delhi, and became its first president. She started the Amrit Kaur College of Nursing and the National Sports Club of India. From 1957 until her death in 1964, she remained a member of Rajya Sabha. Amrit Kaur passed away on 6th of February in the year of 1964. Thank you so much for watching this video. Please like, share and subscribe.